Hello, I am Mariana Mazzucato. I'm a professor at University College London, where I founded and direct the Institute for Innovation and Public Purpose. But I'm mainly here as the chair of the WHO Council on the Economics of Health for All. And I was really privileged and honored when Dr. Tedros asked me to have this honor. Why? Because we were, of course, living through a huge global pandemic where it was just so evident that we were incredibly unprepared at every level, whether it was the test and trace, the personal protection equipment, the vaccine rollout. We got the vaccines, we didn't vaccinate the world, the digital divide with all these children and students around the world locked in their homes and not actually accessing their human right to education. So it was during that COVID moment that Dr. Tedros asked me to chair this council. And it was an honor because, again, COVID just revealed how wrongly we have organized ourselves. If you think back to the moon landing, 52 years ago, government actually took that seriously. It worked with the private sector. It was outcomes oriented. There was 400,000 people involved. There was a clear goal to the moon and back in a short amount of time. Lots of different homework problems had to be solved along the way. The solutions to those homework problems created huge amounts of innovation, from camera phones, baby formula, foil blankets. The whole software industry could be seen indeed as a spillover. Lots of different sectors: nutrition, materials, aerospace, again, software, working together to solve those hundreds of different problems that needed to be solved for the overall mission, the outcome that was being sought. And that's really what's striking, that whether it's for wars or any sort of military industrial complex problem like the Apollo program was, we don't just put money and hope for the best and do a prayer. We actually organize ourselves in ambitious ways, in an outcomes-oriented way. The first thing that NASA did when it tried to get to the moon was to change procurement contracts away from a cost-plus contracting, which just kind of ends up charging governments money with no actual outcome, towards a challenge-oriented procurement contract. The other thing they did was to make sure that the contracts with the private sector were fair. They had a no excess profits clause, believe it or not, with the companies. In other words, if we're going to do this together, if it's going to require collective investment and collective intelligence, then we should be surely not socializing just risks, but also rewards. And that's what that no excess profits clause meant. Very different from today, where we have had massive excess profits in both the energy sector, the health sector, where many large pharmaceutical companies spend more just on buying back their own shares through share buyback schemes than on research and development. And this is really the problem, that innovation in the health sector requires huge amounts of investment across many different actors in the public and the private and the third sector space. What does it mean to have it outcomes oriented towards goals, fostering massive collective intelligence across many sectors, and stimulating that bottom-up innovation in order to achieve the mission accomplished? And this is why, again, it was an honor for me to accept Dr. Tedros's invitation, because how I interpreted it was that, on the one hand, we've had many different studies talking about the importance of health for the economy. What we haven't had is really what Dr. Tedros was asking for, which is, how do you actually organize the economy to deliver on those health goals? So back to the moon landing, how do you organize the public-private partnerships, the contracting, the procurement, the budgeting in order to get to the moon and back again in a short amount of time? What does this mean for health? What does it mean to organize the economy to deliver on health for all, not just health for the some? What does it mean for, again, intellectual property rights, for the design of public-private partnerships, for the design of our innovation systems, for the design of our healthcare systems, and all the social and economic determinants of health, for the investments that we need to be making in those different areas, which my colleague here at UCL, Michael Marmot, has, of course, done such a great service to us all through his own research and leadership in that area. And the Council on the Economics of Health for All was set up back in 2020 And it's made up of 10 women economists from around the globe, from representing every continent. Again, I'm honored to chair it. And what we did was we said, in order to actually achieve this very ambitious goal of health for all, we need to ask, how do we redesign, not just design, but really redesign the economy in order to deliver on that? And we ended up organizing our work across 4 different pillars. The first was on value and measurement. How do we value and measure health for all? What does it mean, for example, for not just replacing the limited concept of GDP, gross domestic product, in Italy, PIL, il prodotto interno lordo, not just with another number that's equally problematic, but with a dashboard. Again, coming back to a dashboard which should be informed by the social and economic determinants of health. If you were driving a car and there was only one number on your dashboard, how much gas you have, or how fast you were driving, or how old your car is, how many miles you've actually driven, you'd probably crash that car. And somehow we've decided that driving and steering our economies are okay just to have one number. And we know that number is limited. Many, including myself, have contributed to the writings to tell us why it's limited. I can tell you that if you pollute, GDP goes up. Just because we have to pay for someone to clean up the mess, GDP goes up. If you marry your babysitter, GDP goes down because a service that someone else was providing that was paid, all of a sudden, perhaps you've married the babysitter, they're still doing the caring work, but for free, GDP goes down. Just those 2 examples should tell you everything you need to know about why that measure is really dysfunctional. So in the work that we've done, we've really thought, again, well, what would it mean to actually value all the different actors that are important for our health systems, including the people who work in the health infrastructure, but also the public sector that contributes to the innovation. It's not just the private sector, but also how do we value our economies and account for them with a really broad dashboard that doesn't just have one problematic number, but steers the ship in such a way that really captures those social and economic determinants. The second area that we looked a lot at was capacity, public sector capacity. So a public sector that can help govern health for all. Of course, it's not just about the public sector, but what we've seen in recent years is really the decimation, the lack of funding towards administrative capacity. And my own institute, the Institute for Innovation and Public Purpose, did a report with UNDP, the UN Development Program, and we found that the countries that did better in COVID-19 were ones that actually had invested in administrative capacity, including in governing digital platforms, of course, because of the infodemic side of the crisis. I've also written a recent book called The Big Con, how the consulting industry has infantilized our governments, weakened our businesses, and warped our economies, because in fact, what we see, including in Italy, is the over-consultification of our public sector. When McKinsey has to govern an EU recovery program, you have a problem. I could say more, but I won't. The third area was finance. How do we actually invest in health for all, both in terms of financing the global commons and actually getting that global finance that we need, which currently globally the Bridgetown Initiative, led by Prime Minister of Barbados, Mia Mottley, and the Secretary General of the United Nations are leading. How do we really get the proper amount of financing we need, both for climate change and both the adaptation and mitigation, but also for strengthening our health systems? The crisis, the COVID crisis, killed many more people than it had to. We had excess deaths because of these weak health systems. We need to finance them and make sure that all these recovery funds actually end up strengthening those systems. And personally, I don't think that most of the global recovery program has gone to our health systems, and that's a scandal. In the UK, where I live, we have nurses and doctors out on the streets striking because indeed the NHS has not been strengthened. And this is very true across the globe, especially in developing countries. But also part of that finance part is the budgeting. How do we have outcomes-oriented budgeting? How do we think of the problems we have in health as requiring, just like the moon landing, all those different sectors working together so that the finance for health outcomes should not just be coming out of the Department of Health, but also out of course, the Treasury, the Department of Environment, the Department of Nutrition, and so on. That's what an all of government and all of different actors working together in an outcomes-oriented way means. And the fourth pillar is about innovation. How do we govern innovation towards health for all? And, even pre-COVID and now, we know that, innovation, again, requires lots of different actors, but that means to actually then govern the process that benefits the most people as possible, right? So benefiting the common good. And if you look at how intellectual property rights have been designed for many years, they're way too wide, just used for strategic reasons, way too strong, hard to license, and way too upstream, so that we're actually patenting and privatizing the tools for research. That's not what the patent system was set up to do. So we really need to make sure that the way we innovate, so the actual business models that shouldn't rely on philanthropy, the way we innovate between all the different actors across the production line, across the value chain of innovation, really is driven by notions of collective intelligence and sharing of knowledge, precisely because if you end up with a pandemic like we did, it's not a coincidence we had vaccine apartheid, not only because of the hoarding of vaccines by some countries, but also because of how the vaccine production itself was done. And interestingly there, we need to go beyond these abstract notions of partnerships and learn from COVID, where we saw some companies like AstraZeneca agreeing to work with publicly funded researchers at Oxford University to share the knowledge, to keep costs low, to not earn excess profits, while other companies did not agree to that. And in fact, some companies like Pfizer have been earning mega profits on the back of a global pandemic, precisely because of how the design of the innovation system itself did not prove to be benefiting, if you want, all the different actors that it could. We had a skewed profit system while we had a really a broad collective intelligence and collective risk sharing. So we need to, if we want to think about governing innovation towards health for all, really think through all those different issues, whether it's intellectual property rights, but also the design of those partnerships themselves in terms of how we agree ex ante to the way to work together to produce the most functional outcome, instead of just thinking that you just need to put a lot of money in a system and then pick up the mess later. And this is really, I'll finish now, what our Council on the Economics of Health for All is trying to do. We're thinking, how can we actually design our economies to achieve those kind of outcomes that we're going after ex ante, instead of allowing the system just to go off track and then patch things up, fill the gap ex post? How can we have a framing around the common good to actually drive the kind of outcomes that we must absolutely achieve around climate, around health, around the digital divide, and really all the sustainable development goals and the 169 targets beneath them? Thank you again. It's been an honor.